Hi everyone, I'm happy to be here for this snack in cardiology. I'm Silvia Castelletti, a cardiologist in Milan, and I'm here with two interventional cardiologists, Professor Vijay Kunadian from United Kingdom and Erik Rafflenbeul from Germany. So we will talk about the trial of the Hotline 7 of today. Let's start with Vijay. So the Neo Mindset trial compared the antiplatelet monotherapy with the DAPT therapy just after standing in patient with the ACS. So what was the main finding and what will be the main impact in clinical practice?
Yes, thank you so much, Silvia. I had the pleasure to chair that very important hotline session. So our guidelines, the 2023 ACS guidelines, suggest that we have to give 12 months of dual antiplatelet therapy, which consists of aspirin and a P2Y12 inhibitor. So what the investigators in this study did was, of course, these dual antiplatelet therapies are associated with excessive bleeding. So they were very brave. So they, after PCI was done, within 7 days, they discontinued aspirin and they carried on with the P2Y12 inhibitor, and the second arm was aspirin plus P2Y12 inhibitor. They wanted to show that discontinuing aspirin so early on following PCI was non-inferior in terms of ischemic events, but superior in terms of bleeding events. They were successful in demonstrating that discontinuing aspirin early on was indeed associated with less bleeding. However, they showed that it was not non-inferior. Maybe there were concerns of some ischemic events, but the sample size was 3,000. Maybe it was small to demonstrate the ischemic non-inferiority. But it's a start, and we need more studies to evaluate this important question.
Okay, great. Thank you very much. And Erik, what is your takeaway from the Target First trial?
Yeah, Target First was presented by Professor Tarantini and is published in New England Journal. And Target First investigated the discontinuation of aspirin after 1 month of complete revascularization in ACS, prolonging a P2Y12 inhibitor against dual antiplatelet therapy. And the main results were that this monotherapy with P2Y12 inhibitors showed non-inferiority according to ischemic events and showed superiority according to bleeding events. So my takeaway is that in modern contemporary PCI, you can select cases with minor or low ischemic risk patients where you discontinue aspirin and prolong the P2Y12 inhibitor therapy as monotherapy with avoiding more bleeding and having the same risk for ischemic events.
Okay, great. Thank you very much. And instead, Taylor Chip trial, in my opinion, was more original because it was a comparison whether modulating the intensity of the antiplatelet therapy may be more beneficial than the standard therapy in patients at high risk. So may you please summarize what was the methodology and the main finding?
Yeah, absolutely. So this comes from our colleagues in Korea. And they looked at 2,000 patients, mostly this time in the setting of chronic coronary syndrome. And again, going back to the guidelines, we suggest that 6 months of dual antiplatelet therapy with aspirin and clopidogrel is what has been recommended based on the evidence. But what these investigators did was they looked at patients who are high risk, like left main, multivessel disease, and they gave patients initially ticagrelor versus aspirin. So it's an escalation instead of clopidogrel and ticagrelor. And then after 6 months, they continued with clopidogrel monotherapy versus dual antiplatelet therapy. So, and the results, they combined the whole ischemic events and the bleeding events as the net adverse events. And again, they showed that there were no major differences in that early escalation. It did not reduce the primary outcome as such as 12 months. So my takeaway is that this study is not definitive. We need more evidence to confirm this finding.
Great, thank you very much. And Erik, for you, the last trial, DAPT shock AMI trial. This is the first trial, that is randomized trial, evaluating antiplatelet therapies in patients admitted to hospital with acute myocardial infarction and cardiogenic shock. What is the main finding of the study?
Yeah.
Will it impact our clinical practice?
Yeah, cardiogenic shock is one of the leading causes where people die from having acute myocardial infarction. So, and it was the first randomized trial investigating what you told. It was ticagrelor crushed, giving to the patient who's not even able to swallow the medication against IV cangrelor. IV cangrelor achieved a faster and more effective antiplatelet therapy. This was shown, and several secondary endpoints were positive. But it was not proven non-inferiority that cangrelor is more beneficial or is not inferior to crushed ticagrelor. I think this is hypothesis generating. Maybe there are some patients where there could be a benefit. So I'm looking for more randomized trials on this, or maybe an even larger scale trial.
Great, thank you very much. Thank you both, and thank you all for listening to this snack.
Bye-bye. Thank you.